And President William Ruto has announced that the government will roll out the universal healthcare coverage in January 1st next year, adding that public discourse on the regulations surrounding it will kick off next week. The president has directed KEMSA and the Mission for Essential Drugs and Supplies, that's meds, to collaborate in procuring and distributing medical supplies across the country with the aim of bringing down the costs. The president spoke in Machakos County during the commissioning of a microbiology laboratory by meds. And as our very own Mary Muoki reports, a gazette notice operationalizing the Social Health Insurance Fund has been published, paving the way for the fold-up of NHIF.
Kenya's journey towards achieving universal health coverage received a shot in the arm on Wednesday when President William Ruto officiated the official commissioning of a state-of-the-art microbiology lab in Machakos County at the Medical Supplies and Drugs Service Meds headquarters in Syokimau. The lab is the second of its kind in the country after the National Quality Control Laboratory and is expected to bolster local manufacturing and reduce infiltration by substandard medical supplies.
This new facility will increase the capacity of the laboratory to carry out our wider range of tests, hence enhance contribution to improving quality of healthy commodities in the country and the region, and fighting the menace of counterfeit medicines.
This institution is a critical cog in delivery of healthcare in this country.
And I want to congratulate MEDS because I have given the same instructions to KEMSA that going forward, local manufacturers take precedence over imports.
President William Ruto reiterated his commitment to the implementation of universal health coverage, adding that the legal framework was now in place to actualize enhanced medical services to all Kenyans. Ruto directed the Health Cabinet Secretary Susan Nakumicha to expeditiously engage stakeholders in the health sector with the aim of finalizing the regulations by the end of December.
Good luck with that conversation, and it is my intention that before 1st of January, we must have settled that conversation.
Health CS Susan Nakumicha on Wednesday published a gazette notice operationalizing the Social Health Insurance Act 2023 that was signed into law by the President on October 19, 2023. The notice reads in part, in exercise of the powers conferred by Section 1 of the Social Health Insurance Fund Act 2023, the Cabinet Secretary for Health designates the 22nd of November 2023 as the date on which the Social Health Insurance Fund Act 2023 shall come into operation. The president insisting that the conversation must be as robust as possible and involve all the stakeholders. He maintained his stance on contribution for healthcare services being commensurate to earnings by individuals.
That conversation must determine how much somebody like the president pays and how much Mama Mboga pays. And my suggestion is that payment of health insurance should be commensurate to people's income, so that those who cannot afford pay less, and those who cannot afford, we can then finance them as government.
The head of state issued a directive for collaboration between the Kenya Medical Supplies Authority KEMSA and Mission for Essential Drugs and Supplies meds, saying their combined forces will account for over 80% of the market share and greatly reduce the prices of medical supplies in the country. Mary Muoki, Citizen TV.